everyone, this is Dr. Owen with Northeastern Spine and Sport Chiropractic here in Elizabeth City, North Carolina. So here I'm going to show you an exercise that we come to after putting you through an assessment known as McKenzie or MDT, which is Mechanical Diagnosis and Therapy. And so it's a way that we find movements to help alleviate the pain that you've been dealing with, and then we prescribe those movements that are palliative to you as your exercise to do at home whenever you feel the discomfort coming on. It gives you something to have in that back pocket that you can pull out to help yourself and not rely on us so much here in the office. So a lot of times we find that extension in the low back helps make things feel better, especially with disc issues. And if you imagine, if a disc bulges to the back, typically, and presses on the nerves back here, and if you're bending forward a lot, you're pressing on that front part of the disc, which then makes the back bulge. So with extension, what we're trying to do is we're trying to compress the back portion of the disc so that any bulging that might be going on kind of gets sucked back into the disc and pushed more towards the front, where the fibers are a lot thicker and a lot less resistant to herniation. So and whenever people say they have a disc bulge, it's almost always going to be a posterior disc bulge coming this way on the spine. So like I already alluded to, the directional preference that we use for this is extension. And so I'm going to start with the two most simple and easy ways that we do extension. And I'll make another video showing you some of the more advanced ways that we do it. So I'm going to set the spine down over here real quick. And so I'm going to do it on the table, but you can also do it on the floor or on your bed, wherever is most comfortable, especially if getting out of bed is an issue for you. You can do this exercise in the bed before you try to get up, and it might help make you be able to get out of bed a little easier. So the first thing we can do is you get down on your stomach, you keep your hips down on the table, and you can either press up, or you can even go just to your elbows if you're not able to go that high up and just rest on your elbows, or you can rest up here at the top. So sometimes the transition of movement is uncomfortable and people just like to stay still, but repetitious movement is the most beneficial way to do it. So we would do slowly, go back down, press back up. So it's almost like a push-up, but keeping your hips flat on the table, and back down. And so with this, usually 10 to 15 reps is good for it. And one thing you might notice also is that maybe your glutes get tight when doing this. One thing you can do for that is before you go up, rotate your toes inwards towards each other, and it helps relax the glutes. And then you might feel that you get a little bit better of a stretch as you come up into your extension. So thanks for watching. That's the first part of our extension videos. Stay tuned, and you'll see our standing extension video here in a minute.